Hi, everyone. Thank you for attending our Medicare webinar. Just wanted to quickly introduce myself. My name is Pat Rufo, one of the partners here at Breakaway Wealth Management, and I'm also joined by Dave Kraus, another partner at the firm. Just a little bit of background on our team. We're a full service firm that focuses on holistic financial planning. We help families get organized from a retirement planning, estate planning, and investment standpoint. And we've helped many families transition through major life events by creating customized plans and investment strategies to optimize their wealth and achieve their specific goals. One crucial area that often gets overlooked is healthcare planning, specifically Medicare. As you approach 65, navigating the complexities of Medicare can feel overwhelming, but making the right choices is essential to protecting your health and financial well-being. So that's why we partnered with Tim O'Mara from Nationwide's Advanced Consulting Group. He's a seasoned expert in Medicare planning. He specializes in helping individuals understand their options, avoid costly mistakes, and select the right coverage for their unique needs. Whether you're enrolling for the first time, considering a Medicare supplement or Advantage plan, or simply looking to optimize your current coverage, Tim is here to help. We look forward to having you join us for an insightful discussion where he will break down the key aspects of Medicare and answer any questions you may have. We ask that you guys keep the questions to the end of the presentation, and then Tim will answer them all at the end. So, Tim, I'll hand it off to you.
Thanks, Pat. Good afternoon, everyone. Thanks for joining us. As Pat said, I'm with Nationwide. Primarily, though, my group is called the Nationwide Retirement Institute. So I tell everybody we're small but mighty. There are 3 of us in the field, plus our field director, which is 4, and then 3 folks that are inside. And our whole goal is to break down and simplify different topics, which end up being decisions or issues that a pre-retiree or retiree needs to make. So there's a list of them, but today we're going to concentrate on healthcare. And if you look at the title, it says healthcare, plan for the costs in retirement. Because what is unique, and I tell everybody this right in the beginning of the presentation, Nationwide's a massive insurance company. We have a lot of different things, products, strategies, solutions, things to buy. We don't sell healthcare at all. So we are not here tonight to this afternoon to talk about healthcare, what to buy, and then, hey, here's what we're selling. We don't sell any pieces or parts around Medicare. That's when usually people are like, well, then what are we talking about then? We want to break down Medicare. I'm going to explain what it is, what it isn't, what you need, the way it flows through, what it covers, doesn't cover, those kind of things. But then I'm going to explain the cost. And I'm not going to go through a product today, but I am going to go through a process. And when we talk about that process is going to allow you to get basically a future look at what healthcare is currently, but then as it goes with you through retirement, through life expectancy. We're not going to talk, this is our little disclosure page, not going to talk about anything as far as product. I am not an attorney, I am not a tax professional, and I don't play one on TV either. So just want to disclose that. So here's what we're going to do. We're set up to do these 3 things at the Institute. Education and insights, which we'll do this afternoon. I'll introduce you to the tool, which is the healthcare assessment. But then the most important thing, and what I was explaining to Pat, is once you go through this, you're going to have more information maybe than you did when you started. Hopefully, I can get that across. But what that's probably going to do is create more questions or realize, wow, maybe I wasn't really going to think about Medicare for a few months or maybe even a year, but now I can kind of look at it into the future. That also creates more questions. We're here to help. You can come back with the questions. You can ask, even if you don't go through the healthcare assessment, but a question pops up, could be next week, could be next month. Just come back through and we'll be able to answer those questions for you. That's what we're set up to do. Our agenda today is talk about the current state of healthcare costs. I'm going to help you understand healthcare costs. This is where we actually go through the alphabet soup of Medicare and then also show you how you can create a plan. So I mentioned that we don't sell anything. And a lot of people are like, well, then again, why are you doing it? Give you some backstory. So the current state of healthcare costs in retirement. Inflation itself, as we all have been through, ebbs and flows, right? Rarely is it negative. Usually we've gone through a couple of bad years in the past. But on average, we have an average of what it kind of balances out to as far as inflation. So if we go back to 2020, What I call goods and services or gas and grocery store, that's up about 86% in that time. Now, if you go and look at healthcare costs, same time frame, it's 121% increase. So understand that healthcare costs has its own set of inflation metrics, different things that drive that. Okay. So if you think you might understand what Medicare is today, the problem is we want to help you see what it looks like 5, 10, 15 years into your process of retirement. And then here's the other one. This is the big one. If we were sitting back in 1975, mid 80s, and we're talking about you going to go ahead and retire and what that all looks like, almost, I would say about 80% of the companies, if you work there long enough, back then used to use healthcare as a key component to retain employees, because they would let them stay on the healthcare plan once they retired, right? That's how it used to be, okay? So now, as you can see, from 2020, we go through 21, 23, now at 24, going through 25, it's probably going to dip back down. There's about 24% of employers that says, yeah, you can stay on it in some form or fashion. Not saying that's complete. They're just offering maybe a little bit of healthcare help in retirement. Here's the problem. Right now, on average, we have about 12,000 people a day turning 65. That's so if we take 12,000, take a quarter of those out, we have 9,000 people that are trying to figure out what Medicare is, what Medicare isn't, what does it do, what do I need? So again, we're here to tell you you're not alone. So questions, concerns, confusion around Medicare, you're not alone. We're here to help. But that's kind of like why does Nationwide do it? Because there's a massive need for somebody to explain it. This isn't a glitch or anything, but usually going forward, I'm going to go ahead and I'm going to stop my video so we can just highlight the content. So I'll stop that. And then we'll go ahead and we'll talk about understanding the various healthcare costs in retirement. So there's a big need. Almost 75% of people wish they had a better understanding of Medicare. The problem is what you see and what you hear versus what Medicare is. That's the disconnect. And I'm going to walk you through what that is and why that is. What we want to do is understand who's eligible for Medicare. So anyone who is 65 or older are eligible if they qualify to collect either Social Security or the railroad retirement benefits. So what does that boil down to? You paid into Social Security for 40 quarters. Call it 10 years. They break it down into quarters. So we're going to go into 40 quarters. Okay. Once you've paid that in, that qualifies you for Social Security. It also qualifies you eligibility-wise for Medicare. Now, the example I also use is if you are married to someone who has qualified for Social Security, as the spouse, that qualifies you for Medicare. My parents, Tim and Chris, will refer to them a lot through this, got married at a young age. Mom was 21, raised 3 of us, didn't have 40 quarters when she turned 21, didn't get any quarters while she was raising us. And then to their great decision, when my sister went off to college, my dad says, well, come down to the restaurant, work there, and I'll pay you under the table. Ooh, oh boy. So my mom never had 40 quarters. So unless she was married to my dad, she would not have access to Social Security and will not have access to Medicare. But she does because she's a spouse. Okay? Whoops. Let me go ahead. Now, let's talk about once we're eligible. Now, you can get also a part of eligibility. If you are awarded disability under the age of 65, then absolutely you can go on Medicare. But you cannot walk into the Medicare office and say, hey, I'm 62 years old and I'm disabled. It has to be awarded by the courts. It has to be approved. Then you can go in and ask to be on Medicare prior to the age of 65. But in general, enrollment is very, very important because there are 2 specific windows. And if you guys are jotting any notes down or anything, I think this may be recorded, so that's good. The first enrollment period is called your initial enrollment period. That's around what we all know is as our 65th birthday. What you may not know is you can go in 3 months before, then the month of, and then 3 months after. If you enroll in this window, I do not care what prescriptions you are on, what conditions you have or have had in the past, procedures, surgeries, treatments, high blood pressure, high cholesterol, smoker, non-smoker, they cannot ask you any questions. Everyone has a clean slate. Okay? So someone walks in, has high blood pressure, high cholesterol, they're a 65-year-old male. Next guy comes in, completely healthy, doesn't take anything. They're going to pay the same thing for premiums. But what's the reality of who is going to use the system more? Well, the person that has high blood pressure, high cholesterol is going to use the system more. So we're going to go, when we do our analysis, we kind of go in depth into, okay, based on conditions, who's going to use the system more and then incur some more costs. Now, a lot of people say, well, wait a minute. I'm turning 65. I have great healthcare insurance, but my spouse is 3 years younger than me. So do I have to, if I'm going to continue to work, do I have to sign up for Medicare? I get this question pretty much on a weekly basis. And there's probably some people on this call right now that are fearing that, well, wait a minute. If I'm going to keep working, do I have to pay for work and for Medicare? The answer is no. The Medicare industry as a whole takes the mentality that everyone at 65 isn't working. It's just an easier mentality. They can't go person by person and say, oh, are you working? Are you not? I'm going to send you an email or a notification or I'm not. They just send and by the way, Medicare, the government plan, and every single insurance company that sells Medicare pieces and parts knows when all of us turn 65. So if you haven't already, get ready. You're going to get mailing stuff all the time. So what happens if I'm going to work? If you're going to work past the age of 65 and continue to be covered under your employer's health care or your spouse's employer's health care, either or, if you're covered by a group plan, you do not need to sign up for Medicare at all at 65. Now, people are going to push back and say, no, they say they're going to penalize me. That's because they don't understand that you're still working. So let's take that 65-year-old couple, other spouse is 62. They go 3 years out. That person's 68 years old. Okay. Now that person's over the age of 65. They're going to go enroll. Medicare says, wait a minute, you're 68. Yeah, I need to enroll now. They're going to go, gotcha. You should have done this 3 years ago. You just shake your head and say, no, you don't. Anyone over the age of 65, when you sever service from an employer, there's a form that you can get. It's a credible coverage letter or proof of coverage letter that says, I want to enroll in Medicare over the age of 65, and I've had coverage up to whatever date. It could be next month when it ends, so you're signing up now, which I encourage you to do. Or you could have said, look, I retired yesterday, last week, or last month. This is called the special enrollment period. This one is 8 months long, but the same clean slate for your healthcare happens. Can't ask you any questions. No scripts, conditions, blood pressure, diabetes. They can't ask you anything, smoker, non-smoker. Those are the only 2 times, though, you can enroll for the first time without having any healthcare issues. The reason I stress that is when we go look at how we put Medicare together, some people want to game the system a little bit, save a little bit of money, and then realize, oops, I think I may have messed up. So enrollment, very important. So again, I'll back 1, your birthday window, or 2, anytime you retire over the age of 65, credible coverage letter, you can enter with a clean slate. I don't care what conditions you have, you're approved. Oops. So when we go to actually choose what we need to purchase or to own for Medicare, I will tell you, again, if you're taking notes, go to the middle of the paper, draw a vertical line up and down. In the middle of the paper, on the left-hand side, put original Medicare. On the right-hand side, put Medicare Advantage, and then I'll explain. So when you go to choose Medicare, you either have to choose 3 things or you choose 2. And people are like, you're nuts, because my parents had like 400 mailers. I'm like, I know, they're going to get mailed all the time, but it all falls under one of these different things, okay? So on the left-hand side of the page, or if you look here on the top in the first path, it says original Medicare. So you go, you sign up for Medicare, you get 1 card. Inside that 1 card, you turn on Part A, that works at the hospital. You also turn on Part B, that works at your doctor's office, and outpatient services. So I'll give you an example. Sign up for Medicare. 6 months down the road, you go to the ER, not feeling well. You're in there for a couple of days. You put down your Medicare Part A card, or your Medicare card. Part A kicks in. Hospital runs up a bill. They send it to Medicare Part A to get reimbursed. Here's the problem. Medicare itself never reimburses anything at 100%. And they tell you that up front. They can cover a majority of it, but it's never 100% covered. by Medicare itself, Part A. Now, because you're at the hospital, you go to the next week to the doctor, you put down the same card, but now Part B kicks in. He checks on you, does this, says, I'm going to send you out for this test. You go to an outpatient clinic, Part B still kicking in. Same function, though. Those bills are sent to Medicare Part B. Medicare Part B reimburses your doctor, not at 100%. So we're sitting there. I have 2 bills, not fully covered. So what do I need to do to cover the rest of that? Well, look at the path. You have Part A, Part B, Part D, but then you have this thing called Medigap or supplement insurance. Medicare says, look, we told you we're not going to cover everything. So what we have done is we have approved vendors and approved policies that you can purchase. Anything that is in royal blue, though, you have to understand. You must go out, research, find, and purchase on your own. It is not part of original Medicare. So it's a third-party vendor. So you're going to go to your insurance companies like Aetna, Humana, United, Blue Cross, AARP. They have one. They have supplement plans, but they're actually underwritten by United Healthcare. But you have to purchase that one Medigap plan, because that Medigap plan is now going to come back and is going to back up Medicare Part A and Part B. So now the scenario is you go in the hospital, you put down Medicare Part A, your Medicare card, it kicks in. You also put down your Medigap card. They bill Medicare, they get reimbursed, then they rebill your supplement company. Depending on what supplements you have, and I'll walk you through those, depending on what supplement you have, it may cover some, most, or all of what is left. Whether it's Part A or Part B, that one supplement plan backs up your hospital and your doctor, both. Now, the last thing you have to add is your Part D or prescription drug plan. So for original Medicare, I choose 3 things. I choose original Medicare and I get my Medicare card. I choose my Part D plan and I choose my Medigap. That's 3. That's the package. It's all good to go. That's complete Medicare. Now let's jump to the right-hand side of the page, okay? This is Medicare Advantage. This is letter C of Medicare. So Part C is the umbrella. You say, okay, I'm going to choose Part C, Medicare Advantage. If you notice, the whole path is in royal blue because every Medicare Advantage plan is run 100% by an insurance company, not the government plan. People are like, okay, well, what's the difference? Well, first thing is Medicare Part C plans, if you see them advertised, are advertised as lower premium all the way down to possibly 0 premium. I'm not saying they're not doing that. They are offering that. But if you think that you have to pay for original Medicare and then there's no premium for an Advantage plan, do you possibly think you're giving something up? And the answer is yes. Now, a Part C plan is going to include hospital, doctor, and prescription drugs. It's going to have all the pieces and parts in there. But here's how it works. A Medicare Advantage company will come into a state, will come into a county. I live in Charlotte, North Carolina, so it's Mecklenburg County. They look at my county and say, okay, what are the healthcare networks in this county? I have 2. You've probably never heard of them. One is Atrium and one is Novant. I'm not picking on Humana, but I just use them as a brand everybody knows. Humana will actually go to Novant and say, we're going to do a Charlotte Novant Medicare Advantage plan. And they create one. They go over to Atrium and say, we're going to do a Charlotte Atrium Humana Advantage plan. So what does that mean? What it means is whatever plan you buy, you're tied to that network of hospitals. That's it. Some are getting a little bit more flexible. They're like, okay, we have two networks. We'll let you kind of go back and forth. But here's the problem. If I bought a Novant plan in Charlotte, I get in my car, I drive 3 hours away inside the same state of North Carolina, and I'm in Raleigh. I get sick and I go to a hospital. My Advantage plan says you have to go to a Novant hospital. Guess what's not in Raleigh, North Carolina? Novant hospitals. So now if I want to enter a hospital, I can. I will still have some coverage, but I am out of network. Everyone knows if you're out of network, that's out of pocket. The reason I'm stressing this is there's a dramatic difference. Original Medicare says this. If you purchase original Medicare, You can go to any hospital, doctor, or specialist in the country that accepts Medicare without any additional copays or out of network charges. None. Here's the issue. What do you see on television? I'll tell you what you see on television. You see Captain Kirk, George Foreman, Jimmy J.J. Walker yelling dynamite, Joe Namath saying, I'm going to pick you up, I'm going to take you to your doctor's visits, and I'm going to bring you hot meals. Those are all Advantage plans. Medicare, as an agency of the government, does not run ads. Those are all Advantage plans. Now, you may see a couple Humana supplemental plan ads as well, because and here's where it gets confusing. All the names I mentioned, Blue Cross, Aetna, United, Humana, ARP, they all sell Medigap plans, and they all sell Advantage plans. They're on both sides of the page. But you can't own both. You can only own one. Okay? So remember, original Medicare, which is really what most people buy, at least in the beginning of retirement. Example, let's go back to my parents. I was born and raised in Ohio. I've lived in Charlotte for the last 21 years. My parents are now 81 and 76. So 11 years ago and 16 years ago, they went on Medicare. Purchased it in Ohio. Went on original. Way back when, I have a 20, an 18, and a 17-year-old. When grandbabies were born, mom and dad would come down. Mom would bring, our dad and mom would come down. Dad would go back up for work. Mom would stay for a month or two. She had to go to urgent care. She had to get a test. She whatever, had a cold, earache, something like. She could go to any doctor she wanted in Charlotte. There's no additional charge for that. Now, original Medicare costs more, naturally, than Advantage, but understand what you're giving up. You're giving up flexibility. Okay? So that's the difference between the two. So if I choose original Medicare, I'm going to go Medicare, my Medicare card, which is 1. I get my 2 parts, my Part D, which is 2, and then my Medigap, which is 3. On the left-hand side of the paper. On the right-hand side of the paper, if I choose Part C, the second thing I have to choose is what insurance company am I going to use that is in the healthcare network that I want to go to in my area. And again, scribble down any questions that you may have. So let's real quick talk about the different pieces and parts. So how much do we pay per person per month? This is, if we were live, this is one of my trick questions. How much is Medicare Part A per person per month? Then the answer is 0. But if you see where it says on the left under Part A, you have a hospital deductible. You walk into the hospital and you put down your Medicare card. The first thing they're going to ask you is, do you have a supplement? Now remember, you have to add it yourself. If you're one of those people I mentioned that wants to game the system and say, I'm 65, I'm healthy, I haven't been to a doctor in 2 years, I'll take a couple of leave, or some Mucinex, I'm fine, haven't been to the hospital in like 10 years. I'll add it when I need it. Here's the problem. You're not going to realize you need it until you're in the back of an ambulance or someone's got you in a car and they're taking you to the ER. You get there, you put down your Medicare card, and you don't have a supplement. They say, no problem. We're still going to admit you. You're going to have great care. But because you don't have a supplement, your deductible for walking in the door is $1,676. How fast do you think you'll rack that up in an ER? Minutes? If they say, do you have a supplement plan? And you say, yep, here's my supplement card. Guess who pays the $1,600 for you? Every time. That's why it's important to have them together. Now, deductible on the right-hand side for Part B, different. Now remember, A, no premium for A. I didn't say it's free. I'm just saying on a monthly basis, you do not have to pay for A at all because we prepaid it. Every Medicare tax deduction line that you see on your paycheck, the Medicare tax, that goes to prepaying our Part A. Part B says, well, you have a deductible, but as you can see, it is much, much less, and it will cover you for the whole year, which is different than covering you only for 60 days on Part A. So you pay $257 that covers you for the whole year. But Part B comes with your first premium. So if we look at this chart on the left, if you are an individual when you file your taxes, those are the income brackets that they look at. If you are married filing jointly, you're in the middle. If you are married filing separately, then you fall under the left-hand side, which is individual. Then you look at the far right-hand side, that's how much Part B costs per person per month, depending on your income. What do you mean, depending on my income? Medicare every single year looks back 2 years to your tax return. And they say, what is your modified adjusted gross income? Where does it fall in this chart? These are not tax charts. These are only income charts for Medicare premiums. So if you're 106 or less as an individual or married separately, then you're going to pay 185 currently this year per person per month. If you're married filing jointly, less than 212, you pay 185 per person per month. Unless your income's higher. Now, most of us, I would imagine, we're in our peak earning years. We're working, and then we're going to stop. Could be both of us stop working, 2 paychecks stop. Yeah, our income's going to be lower. But what happens 3 years from now, 4 years from now, 5 years from now? Right now in 2025, they're looking at the 23 tax return. Next year in 26, they're going to look at 24. Next year in the year after that in 27, they're going to look at this year. It never goes away. It's an every year 2-year look back. Let's say down the road, example I use, I cover the whole East Coast. Example I use, I have a guy in Florida. He goes, I want to buy a boat, give it to my son, leave it to him and the grandkids. Okay, well, how do you want to do that? Well, I'm going to take $80,000 out of my IRA. Okay, well, if you take 80 out, it's going to be taxed. He goes, I know. I'm going to take out 80. I'm going to pay the tax, net the money for the boat, and I'm going to buy it. Okay. I said, here's the problem we have. He's like, what's that? I go, you're going to add $80,000 to your tax return in 2025. 2026 won't matter. In 2027, when we look back to this year, you're going to add $80,000 onto your tax return that you were filing jointly with you and your wife. Yeah, that's going to put you over 212. What does that mean? Well, that means you're probably, instead of paying 185, you're going to pay 259 per person per month. Well, just me, right? I go, no, both of you, because you're filing jointly. He's like, it's not her money. I go, it is on the tax return. So you just moved up her Part B cost. Now, here's the biggest problem. Everything you see on the right-hand side, Medicare Part B premiums, if you're on Medicare and you're on Social Security, that automatically comes out of your Social Security check. So now I have to warn him, hey, get ready. He's like, get ready for what? In 2027, when your Part B goes up, your Social Security check will go down. Why? I go, remember Part B comes out? He goes, oh, that's right. I go, and now you have to go tell your wife that because you're buying a boat in 2 years, her Social Security check's going down. He's like, I can't do that. I'm like, you have to. It's the way they all work. He didn't. That was the hardest part of that whole thing for him, was telling his wife, hey, in 2027, we're probably gonna have lower Social Security checks because we're gonna have to pay a higher Part B premium. So understand how those premiums work together between Social Security and Medicare. Real quick, what's not covered under Part B? You do not have what I call from the neck up. No dental, no vision, no hearing. Foot care is not. And by the way, there is zero long-term care at all. There is no long-term care with Medicare whatsoever. Medicare reserves the right, if you are in the hospital and you have a condition where you cannot get any better, but the hospital care is not going to do you any good and you need to go to a facility, or if people come into your home, that is where Medicare cuts you off, and now you are paying dollar for dollar unless you have long-term care coverage. It's brutal. I run into a dozen situations a year of folks calling me about their parents saying, what do I do? Medicare's not paying. I go, unfortunately, it's too late. Medicare is for health and hospital and doctor. It's not for long-term care. Okay? Any care outside, most care received outside of the United States is not covered as well. Now, there are different things you can buy. There are different companies you can go to get dental, vision, and hearing if you so choose, but that's a separate outside of Medicare coverage. So let's talk about the 2 things you need to add. So I need to add a Part D plan from a third-party vendor, and I need to add a Medigap plan from the approved plans that Medicare offers. So how does that work? Oh, look at this. Does this chart look familiar? Because it is. This is the same exact chart from Part B that they use to see, do you have to now pay more for your Part D prescription drug plan? Same scenario. I'm looking back 2 years. Where do you fall? So think about that. Medicare Part A, not a monthly premium. Medicare Part B, I have a premium that's based off of my tax return from 2 years ago, and so is my Part D premium. If you look on the far right, it's not as drastic as the Part B increases, but it's still it's an important way or reason once we get into retirement to make sure that our centers of influence, being our financial advisor and our tax professional, unless you're doing your own taxes, are aware of what's going on. And then even anything outside of that, is there any type of property that could be sold that's not your primary? Is there a part of a business that later you are bought out in? Is there deferred comp? There's a lot of different things that could come into play that is important to have your centers of influence around how you're planning for retirement. Make sure they're in concert with each other so we don't have to go $1 over and now we're paying more. Now, will it go back down if the income goes back down? Sure. But if you can avoid it, by all means, try to avoid it. Part D, what's important to understand about Part D? You need to own what covers your scripts. My parents are on 2 different Part D plans as of right now. I'll get into that, what I mean by that in a minute. Part D plans vary. Think of it kind of as an inverted pyramid, right? It's narrow on the bottom. As you go up, it gets wider and wider and wider, meaning there's more and more prescription drugs that are covered in that plan as we go up. But as we go up, so does the cost. Here's what happens. People turning 65, they start running around saying, I'm turning 65. I have these 3 scripts. I don't know what to do. You start asking your neighbors, your relatives, your friends. I got to say your pickleball partner, right? And they say, well, I have 3 scripts. I pay $28 a month and they're $5 copays for each script. Perfect. I'll buy that one. Here's the problem. A $28 plan is going to be for generic only scripts and your $5 copay. That person's on 3 generics. You're on 2 generics and a brand name drug. So 2 will be covered. The other one will be out of pocket $420. And you're like, but it can't be because I have a Part D plan. And they'll tell you you have a plan, you don't have the right one. So you have to have the ones that will cover your scripts. The minute I say that, people's minds start racing. They're like, wait a minute, I can do generic right now, but I don't know what I'm going to need in years 5, 10, 20. Like, what am I going to be on? Every year, there's something called open enrollment. Happens mid-October to the first week of December. Happens every single year. Inside that window, you can change your plan for Part D without any questions asked. If you need a better plan, go get a better one. But what if 5 years down the road, this blockbuster brand name drug you're on all of a sudden has a generic alternative? Well, you can roll back down if you want to. There's flexibility built in every year. I'm not saying you're changing every year, but you have the ability to kind of look at it and say, am I okay? Is there anything that isn't covered? Happened to my mother-in-law. She got prescribed in around mid-August, a brand new AFib drug, signed up during open enrollment, but it does not kick in until January 1. So she had to bite the bullet August through the rest of the year. So important to understand there's flexibility built into Part D. And then lastly, what's my last piece I had to put together? This is where we get into your supplement plans. There are 10 that are on the board. Why in the world they used letters again, I have no idea, but they did, and people get completely out of their mind confused. So there's 10 on the board. 2 of them are grayed out. C and F were the 2 most popular plans purchased up until 1/1 of 2020. Then they were frozen. And people are like, why you still have them on there? Well, if you run into my dad, or you run into my mom, or you run into someone that's 72, they're probably going to be on C or F, and we can't buy that anymore. But the other reason we did it for is to say, on a spreadsheet, if I'm looking at this, if you guys start looking at this, every block that doesn't have a number in it means we are 100% responsible. Do you think A and B are attractive? I would say no. C's not available. D looks good. F, can't buy it. G looks real good. I'm going to skip it for obvious reasons. Then go to K, L, M, and N. Now, K, L, M, and N, those are better than A and B, but now they're messing around with the percentages. They're only covering 50, or they're only covering 75, and they have boxes missing. So based on this spreadsheet, as you can see, the best supplement to buy is letter G as in George. It's the most comprehensive. It will cover the most. Okay? Now people say, well, what do you, when you mean G, like which G is the best? I'm not trying to be a smart aleck when I say this, but a G plan is a G plan is a G plan. United has to do the same by the rules and regs. So does Humana, Blue Cross, and they all have to do the same thing to be considered a G plan. G is the most comprehensive and will reimburse and cover the most for you behind your hospital coverage and your doctor coverage. Now let's talk about real quick, what happens if I'm in a situation where either I messed up or as we go down the road, I keep mentioning my parents. My parents are in a situation right now where we're going to look to switch them. Okay? On the left-hand side, where it says guaranteed, I'd like to say highly likely, but I have original Medicare with a Medigap plan. You talk to my parents, they have original Medicare with Plan F. It's been phenomenal. My in-laws have the same exact thing. Been phenomenal. I will tell you, I have been through knee replacement, hip replacement, heart cath, prostate cancer, breast cancer, triple bypass surgery, heart ablation, and my garage, I'm not kidding you, it looks like a mini ER because they've all rehabbed at my house with their conditions. But my parents, 81 and 76, sitting in Charlotte, can we go and say, look, Dad, Mom, you guys are not going anywhere at 81. I live here. My sister lives here. My brother's in Boston. He's out of luck. Get on a plane and come down. Can we maybe look and say, look, where do you go more? Do you go more to Novant or more to Atrium? They go about 78 to 85% Novant. Can we move from original Medicare and move them over to an Advantage plan that covers Novant hospitals during that same open enrollment that starts in mid-October? You can do that move. It'll kick in the beginning of the year, and they won't ask you any questions. Now, my parents are paying over $350 per person per month for their supplement. I mentioned how the flexibility worked great when kids were young and they were moving around and seeing everybody. They were all over the country. They're not doing that anymore. Can we move them and save over $700 a month? Yes. Below that, if I have a Medicare Advantage plan and I like my plan and the plan is good, and then I walk into my doctor's like, I don't accept your Advantage plan anymore. You're like, wait, why? Advantage plans are run 100% by the insurance company. They change the rules every year. What I mean by rules, how much are they reimbursing a doctor? Are they even going to reimburse a doctor's patient for that? Doctors get mad because they're like, I run this test on every male over 60 and you're not going to reimburse it. I'm not going to accept your plan. And you're like, Doc, I have that plan though. He's like, you have to find another doctor or you have to switch to a different Advantage plan. Or you live in Charlotte, Ohio. Charlotte, North Carolina. And my parents moved back to Ohio and they were on that Advantage plan. They'll have to find an Advantage plan that covers them in Ohio. Right-hand side, not guaranteed. This is where they're going to ask you any and all medical questions, healthcare questions they want. I have original Medicare. I had a Medigap plan. I want a different Medigap plan. Why would you want a different Medigap plan? Well, I know you told me A didn't cover a lot, but it was the cheapest. So I thought I was going to try to save some money. Now I'm paying through the nose for all this stuff I don't want to pay. I want to go to G. You can try that anytime you want, but you can be denied because they're going to ask you. This is where I tell you Medicare's dumb. They're not that stupid. Last one. This is the most difficult one by far. I have a Medicare Advantage plan. I need help. I told you about my parents. My in-laws have been divorced. They were married for 16 years, been divorced for 40, I guess, if I'm doing the math right, 30 some. So my mother-in-law lives here, to my joy. She lives 8 miles away. My parents live 12 miles away. My father-in-law, I was off the hook with that guy because he was in Florida. Until 7 years ago, he calls me. Calls me son. He goes, son, I'm coming up to Charlotte. I go, great. Grandkids will be excited. What are you coming up for? He goes, I'm interviewing doctors. I go, you're interviewing he's in Stuart, Florida. I go, you're interviewing Stuart, Florida doctors in Charlotte? He goes, nope, I'm interviewing Charlotte doctors in Charlotte. I go, why? He goes, I just left and they told me I need triple bypass surgery. I go, what? He goes, yep, I need triple bypass surgery. I go, they don't perform that in Stuart, Florida? Or anywhere else like Miami? He goes, nope, that's not the problem. The problem is after I go through the surgery, I have to go through a checklist of when I go home. So when I go to my house and I pull into my garage, I have to walk up a flight of steps to get to the main living area, and they got to walk up another flight of steps to get to my main bedroom. And they said I can't do that for 30 days. I go, what? So why are you coming to Charlotte? He goes, because if I walk in your garage, I walk up 3 steps, I bang a left, and I'm going to use your spare bedroom and your spare bathroom, and I'm going to get the surgery. I'm going to rehab at your house, which he did for over a month. All 4 of them. He had original Medicare. If he had an Advantage plan and he has to say, I need to move, like, can I try to go to original to go anywhere? Or can I try to get to it? He would be stuck. It would be tough. So understand certain things, certain rules that go around. So where do we come in as far as creating the plan? We'll go through this for about a couple minutes and then we'll wrap up and start taking questions. So where do we come in? It's a personalized report just for you because there are variables that are involved. Number 1, where do you live? There are 2 things that drive healthcare costs. I told you about the inflation. What's built into that inflation? 2 things that are in that inflation number, demographics and geographics. Everything's more expensive in the city. Major metros, Northeast primarily. Okay. The other one's demographics. Is there a higher concentration of retirees? Told you I cover the whole East Coast, and I feel bad every time I do it in Florida. I'm like, if you're in a major metro in Florida, you got 2 things going against you. But guess what? That's changing because everyone's not moving to Florida. So across the country, people are aging in place, meaning in their home state or where they are right now, or maybe with family. Everyone's not in Florida. So all the demographics of all the states continue to grow as everyone's longevity keeps increasing. What we do is say, okay, go through the report, give us some information. Can I help you if you're 64 turning 65? If you're 65 getting ready to sign up, can I help you? Absolutely. If you're under 65, can I help you project what it looks like? 100%. You actually have a little bit of a luxury because you have a longer runway before you have to start paying. So can we position things in a portfolio? Can we work with the team and figure out where, what do we want to do? What income will I need? I have to get a budget together. This is what I call part of retirement planning 101. How much do you need to live off? How much do you need to operate your household in a given year when your paychecks stop? Sit down, figure that out. Chances are a lot of people, and it's no one's fault, a lot of people undershoot what healthcare is. Or they may get it right in the beginning, but that's not a stagnant number. You have to add inflation to that. So this is a husband and wife. They're both 60, so we're going to push this out 5 years. We're going to price original Medicare. They are in the first income bracket. We're going to use a G for the supplemental, and we're going to add all additional costs for them. But we have to go out 5 years. We're going to add premiums, out-of-pockets, co-pays, everything. So we get it into years 1 through 5. People get a little excited. They're like, wow, for the first 5 years, it only costs $24,000. No. $24,000 is the average per year for the first 5 years. So it'll be less than 24 in years 1 and 2, right at 24 in year 3, and over 24 in years 4 and 5. And that corresponds with the increases. The drop you see back in year 16 to 20, that's when he hits his life expectancy. Those are her costs going forward. Now, a lot of people usually lose their mind right now. If we're at a dinner doing this, they start throwing food at me. I get it. But then we break it down for them. And we say, look, here's how it breaks down. There's no such thing as joint Medicare. You have to be on one side. They have to be on the other. Meaning everybody has to have their own Medicare card, their own Part D plan, and their own supplement. All we do is simply say, here's the breakdown of the cost. So if you kind of look at these headers, for him, you're going to have your Part B or private insurance. We're going to show you what the Part D cost. Is there any income-based surcharges because of your income? Yes. If there's not, then there's not, so the number would be lower. Your Medicare supplement plan, and then random additional costs. The total for him is 10. You slide it over, the total for her is 10, but it's a little less. And then you have household total, which is 21. I told you it'd be 21, 22, 23, almost 24, and then 25, 26. So there's a household total that you see on the right-hand side says 21,000. But then there's a net cost that says 13. And everybody says, ooh, I like net costs a lot better. Okay. What does that mean? if you are on Medicare and you're on Social Security, Social Security covers his Part B cost column and her Part B cost column. So we pull those out. Now sitting down, how much do you have to budget for? I have to budget for 13, 13, 14, 15. Because Social Security's picking up a chunk of that. You're still paying it. It's just not coming out of your checking account. And then we're going to ask you a couple questions. This is our questionnaire. It is extremely. It does not take even 5 minutes to fill out. It is super, super easy. One thing that the people on the call need to know, I will never ask you for your home phone, your cell phone, your email, your X account, your Pinterest, your TikTok. We won't contact you. We will go through Pat and Dave. We'll have their information. I've shown this in the beginning. The advisor information goes on the top. That is it. So it's their email. It's their phone number. Those are the people we contact. We have no information to contact you. But we will by all means jump on a call the minute you get the report and walk you through it and answer your questions. So with that, Pat, if you want to, or whoever's going to kind of maybe open back up the mics, I'll jump back on video. If you guys want to. I don't know if you guys can see me back up or not. Pat, you with me?
Yep, I'm with you here. Teresa, are the mics open for everybody?
They just have to raise their hand and I can unmute them individually.
Okay, great. So
I'll do it in order.
If there's any questions out there that you guys want to have answered, please feel free to to raise your hand.
See, Bruce has a question. Bruce, you're live. Bruce, you with us?
You might be double muted, Bruce.
See if there's a mute on your own screen, Bruce, that you can unmute. Not hearing Bruce. Anybody else want to raise their hand with any questions? And any question can be asked, please. If I need to review anything, I can go back, not a problem. I don't see any. Bruce's hand went down. I don't see any. So what I'm going to do, just to jump back.
Bruce,
You hear me now?
Oh, there we go,
Yeah.
Bruce. Go ahead.
So I've been looking at Part G, and I know that Part G is Part G, like you said. But what I'm not understanding, and maybe it's because I'm coming from a standpoint of being a CPA and a finance guy, but why are there drastically different premiums? Same location, same, it's all Part G. And when I look up one national, insurance carrier versus another, I've seen very different Aetna versus United versus whoever premiums. If they're all the same, covered the same by law, why the premiums so varied?
I will tell you that by law minimum, they have to cover that. If they throw anything in extra, possibly a different perk here or there, number one, that could be a reason for the cost. But as far as what you see on that screen, bare minimum to be a G. If they add a little something in and want to charge for that, they can. But the other thing is, and this is going to sound weird, some companies price themselves out of certain areas.
Okay, that makes sense.
Because if Aetna's high where you are, it may be one of the best down in maybe the Carolinas or maybe in Texas, right? It depends on when they look at their overall risk and exposure, because that same thing happens with Advantage plans. I could pull up a list of Advantage plans in your area today and pull up another list next year, and 5 of them could be out and 3 more could have come in. So it's a kind of ebb and flow. So it could be anything they added to the G above the minimum, or it could be they're just pricing themselves out of a certain area.
Yeah, I'm in New Jersey, so it's high priced.
Would be yes.
Okay, thank you.
Yes.
All right.
Any other ones?
Doesn't seem like we've had anyone else.
So I'll wrap it up and then Pat, I'll throw it over you to close. Just to let you guys know again, this form super easy to fill out. I encourage you to do so. Fill it out, get the report. Some things, and by the way, I told you demographics and geographics matter. Demographics, you can actually put multiple. Oops, let me go back. If I blow this up a little bit, bring it over. You can put multiple states in there. If you see states, county, city, and counties, so we can price different ones. Especially my friends in the Northeast that may be going back and forth between the South or Carolinas, Georgia, Florida, and the Northeast. You want to price them out 2 different ways. We can do that. But just take the time because you're going to get a lot of great information. Again, this right here is not going to tell you what to buy, but it's such a vital number to help in what you're doing and planning for down the road that and if you have time, like I mentioned, it's going to give you time to prepare to have certain things in the overall plan inside the portfolio. Is there certain things that we can earmark? Because I know for a minimum, I want to be able to pull X what I need out just for Medicare, and I can make sure I don't have any worries about that with market fluctuation. A lot of different ways to plan for that. So hopefully everyone takes advantage of it. And also, as I mentioned before, questions that come up tomorrow, questions that come up next week, anything else. Dave and Pat now have a resource they can call anytime with our team at NRI, and we can answer those questions for you.
Thank you so much, Tim. Really appreciate your time. Thought this was very informative. Hopefully all the attendees agree with me here. Again, if any of you want us to take a look at this fact-finding sheet, please feel free to reach out to myself or Dave, and we can kind of get the ball rolling on this. But thank you all for attending, and have a great night.